Hi, I'm Dr. Brose. I am from Jefferson University from the Sidney Kimmel Comprehensive Cancer Center. I'm here presenting the data on larotrectinib in advanced thyroid cancer. And this is a result of 3 clinical trials that were put together to pull together all the thyroid cancer patients. So TRK fusion is actually present in a good number of patients with thyroid cancer. 20% in patients that do not, up to 20% in patients that do not have a BRAF mutation. So people who have thyroid cancer, if they don't have BRAF mutations, you want to make sure to check if they have a TRK fusion. So these were TRK fusion patients that were enrolled, and you can see here the methods that there were 3 clinical trials put together. And all of these patients that we're going to talk about today were on one of those 3 clinical trials. Let me just point you here to the characteristics. So the patients were median of 6 years. They had mostly TRK 1 and 3, which are the most common TRK fusions. And most of the patients were either treatment naive or they may have had lenvatinib or another multikinase inhibitor. And what you can see right here in the tumor response is that it's really quite remarkable. We had patients with 100% complete response, which in a metastatic setting is really phenomenal response. But the other thing is, if you look here in the treatment duration, many patients are up past 5 years. So this is the follow-up data after 6 years of follow-up from the original clinical trials. And if you look here, you'll see our overall survival. If you look down here, actually, you'll see duration of response, PFS, and overall survival. And our overall survival at 6 years is 71%, which is a really high number. And we still have some patients here. The average was 47 months. So, and that's just progression-free survival. I'll point out that that's not clinical benefit, because many times when they progress, they might have a solitary nodule. We can take that out. They get another 5 or 6 years. So we have patients literally who've been on this drug 10 years or longer. So the clinical benefit's even longer than the progression-free survival, but having a progression-free survival of an average of 4 years is really extraordinary. But what I love even more in this field is if you look at the AE profile, you can see that the majority of AEs for larotrectinib are all grade 1 and grade 2. Very few are grade 3 or more. So patients tolerate this remarkably well. And because of that, in my treatment paradigm, we say for people with differentiated thyroid cancer, if they, before you treat them with any multikinase inhibitor, you should get next generation sequencing. And if they have a TRK fusion, that should be their first line. But then they can go on to the other agents if they need to. So thank you for your attention.